to have you with us. We will really need you in the future for really pushing this agenda together in, of course, in the Islamic Republic of Pakistan, disability inclusion in the health sector, and leadership as already, as you will show us, you have shown in the agenda of assistive technology. But having a voice of a parliamentarian is already having a voice of a policymaker on the table. So, and that is the reason why your voice is so important today with us. You also bring the country perspective that is so fundamental and that always serves as an example for other countries. So, Dr. Hamid, please, you have the floor.
Chair, Excellencies, colleagues, I would like to congratulate WHO for organizing this side event on a very important issue which needs global focus, and all member states to work together to achieve the agenda of disability inclusion in the health sector. When people think about persons with disabilities and access to health services, perhaps the first thing that comes to the mind is rehabilitation and access to assistive technologies. During the last years, Pakistan has played a leadership role in moving the agendas of rehabilitation and improving the access to assistive technology at global, regional, and national levels. Firstly, Pakistan has supported the WHO Rehabilitation 2030 initiative since its beginning in 2017. With the support of member states, Pakistan also played a fundamental role in the adoption of global and regional resolution on assistive technology. At national level, many concrete actions have been taken. First, exhibiting high political commitment, a parliamentarian committee on rehabilitation and road safety with representation of all political parties was convened. The committee advocates for more budget allocation, legislation, oversight, and accountability for rehabilitation and assistive technology in the country. Second, the assistive technology has been included in the Prime Minister's National Health Insurance Program. Under this program, all persons with disabilities who are living under the poverty line are being provided with health cards for provision of medical treatment, including the rehabilitation services and assistive technology. In terms of improving the access to assistive technology in the country and to assess the proportion of population in need of assistive technology, Pakistan was the first country globally to pilot the Rapid Assistive Technology Survey. We now have a National Disability and Rehabilitation Strategic Framework 2021 to 2026, which has integrated assistive technology as an important component of rehabilitation. There are just some of the actions that Pakistan has taken to advance the agenda on rehabilitation and assistive technologies. However, alongside rehabilitation and assistive technologies, there are more components in the health sector that need to be strengthened if we want to achieve disability-inclusive health services. The recently adopted resolution on the highest attainable standard of health for persons with disability provides WHO with a great opportunity to pave the way for countries to advance their disability agenda in the health sector. As we already heard today, there are three main pillars which we need to focus on: access to effective health services, protection during health emergencies, and access to public health interventions. Pakistan is committed to work towards strengthening these areas. In fact, the Ministry of Planning and Development and Reform and the Statistics Division published recently a disability inclusive project document that stipulates that no public sector projects shall be approved unless infrastructure is disability accessible. In addition, a national policy dialogue for young with disability was organized to improve the situation of young people with disabilities. Since the beginning of COVID-19 pandemic, several actions were taken by the government. The Pakistan Preparedness and Response Plan COVID-19, which ran for 9 months from April to December 2020, incorporated considerations for disability and persons with disabilities. The plan was prepared with support of UN and was guided by the WHO Strategic Preparedness and Response Plan with an overall objective to help prevent and limit the spread of COVID-19. Pakistan also undertook a national need assessment survey on COVID-19 and disability, which was a collaborative effort between the government and WHO. The surveys provided essential information on the challenges, barriers, impact of COVID-19 pandemic on people with disabilities and caregivers, healthcare services, rehabilitation activities, and activities of daily living and other activities of persons with disabilities. In addition, information and communication materials on COVID-19 measures and response were made accessible to persons with disabilities. COVID-19 has showed us that a lot more needs to be done to ensure that the needs and requirements of the person with disabilities are met. And we can only achieve this goal if we all work together towards a disability-inclusive health sector. Only by doing this, we can envisage a world where every person enjoys the highest attainable standard of health as their fundamental right. I thank you.
Dr. Hamid, thank you so much. Your presence here today, as I said, means a lot for moving the agenda, as you have said, of rehabilitation assisted technology, but also now for championing the agenda of disability inclusion in the health sector as a whole. So that is absolutely fantastic. Thank you so much.